control.
So basically what you're doing is you're stripping all the layers away to get to the bare bones.
I'm getting down to the fact. Yeah. The fact is, you're doing all that because
Gary,
you hate
how
them.
much money was spent on the cigarette?
I don't care, I honestly don't care, but give it an average, say an average of €7 a packet for 34 years. Well, I know, but they went over to tenner, so say an average of €7 for 34 years. What's that, Jim?
Instead of golf clubs.
all the holidays you've taken away from Jim. All the money he could have had.
I could have been in the Bahamas.
Yeah.
With the golf club.
Have you ever calculated out the hours?
Yeah.
Why did you not use 24 hours?
Because you're not awake for 24 hours. It's easier. I mean, you could, okay, you could take working out over 14 hours, but it's just 12 hours. You're not asleep, or say you're not awake for 24 hours a day, so you wouldn't calculate by 24 hours. That would be false because you're asleep for half of it, most of it. Yeah? It's an average. You could give or take a few thousand here. It doesn't matter. It's 240 something thousand.
It's a shock factor, isn't it?
In this session, I am going to put the pain into Ger, okay? Emotional pain, but it's not to be mean to you, it's to help you. Is that okay? I'm getting permission to do this.
It's very big and you have to do it actually.
If it's see Ger's husband,
Yeah.
yes.
Yeah.
Because if you want to walk out here and never smoke again, that's what we're going to do. Okay. Fantastic. Relax me. Okay, so I wasn't going to do this session, but I think we should because the lady's in so much pain. I think you need to do it. What is your biggest fear about continuous smoke? It's like driving the car and you're tired, with a rattle. That car is telling you, well, this is the first part of the car that's in trouble. You need to pay attention to it. Yeah. The good news is there's no bad news. Sorry. I robbed these bits off people. Sorry. It actually came from Eamon. Eamon up in there. So I'm not going to do the rocket induction because we all know it, we all understand it, and it's going to take 15 minutes away from the rest of the day. So we're going to do an instant. And do yourself a favour, Jack. When you hear that word sleep, let yourself go. Okay? The deeper you let yourself go, the easier this will be. Okay? Lovely stuff. So would you just lift your hand up and down? Stephen, sorry, would you get a glass of water, please? Yeah. I have the best job in the world, would you agree?
Yes.
Yeah. Would you agree?
Yeah.
And you're all going to have this job. But it's up to you to decide how good you want to be.
That's protein in that glass.
That's it.
Protein in that glass.
Oh, I will pay. No, Annabelle. Well, okay, so let's do it. While I'm doing this session, will you all do me a favor? Sorry, will you all do a favor for this lady? Will you send her intention? Feel it in your heart. Absolute intention of success and freedom to finish this here today. Because you'll feel it, trust me. Are you comfortable like that, Ger? Yeah. Sure? Okay. So when you're ready, just lift your hand up in the air. Thank you. Just all the way up. See? Never stops, does it? Never stops. I asked a certain way, I should know that. No. Thank you. But again, and just really important this, let's do it again the same way. Would you just lift your hand up in the air and you just go as far as your elbow. Now, if I don't pull this up, what am I telling her subconsciously? Well, you don't have to do the next thing I say. That's exactly what I'm saying here. So, and I go, no, it's up, up, Ger, thank you. Now she knows everything I say I want done properly. So, press down there, close your eyes, fill up your lungs as much air as you can hold when you're ready. And press as hard as you can, hold the breath. And as soon as you hear me say that word, you know what's going to happen. Now, think about the first 6 to the last digit of your registration number. Sleep! Way down, that's right. Way down, it's going to 5, just sinking deeper and deeper down. 4, just stripping down every fibre, every muscle, every tissue, going way down towards 3, way down towards 2, and then all down towards 1. That's right, just deeper, 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 Lovely stuff. I'm just going to gently touch your head. You're going to find this lovely energy is just going to lift your head up into the most comfortable position. That's 3, 2, 1, bang. Just feel it just rising up into the most comfortable position for you. And every time I touch on the left shoulder, say the word sleep. You're going to go deeper and deeper, deeper down. If I lift your hand up and go sleep, you're going to go deeper and deeper down. And every time I go sleep, it's deeper and deeper down. And every time I touch your head rises up. And every time I say the word sleep, your mind goes down. And up. And then try and open your eyes. And I really genuinely want you to try that. Now, I want you to put everything on this. If they open, I'll suck it up, I'll be okay. Deep breath. That's done. How quick? Ger. And everybody say in the room right now, from this moment on, yeah, send it. You do that for me? Ger. I want you to imagine for a moment. Now, sometimes when people imagine they can see clear pictures and other people can't, isn't that right? What I'd like you to imagine is that you're sitting in a waiting room. Like a doctor's waiting room or a dentist's waiting room. And you're the only person there. And what I want you to do there is I want you to imagine that behind the door on the left is you this time next year is still a smoker. And I want you to imagine behind the door on the right this time next year, you completely free, having never looked back from today, ever. Never even thought about it and wanted it. And imagine as you sit there looking at the two doors, you realise you have an option. You have two options, in fact. And both of those options will rely on one thing, a decision. A real decision. But don't make any decisions yet. You see, if you think about it, you decide what clothes to wear, right? You decide to come here this weekend. You decide what food to eat. But today, you're going to make the decision that will determine the rest of your life, your happiness, your health, your freedom. So what I'd like you to do is imagine going in and meeting Ger behind that door on the left 1 year from now. Imagine she has a cigarette in her mouth. And on the floor are 7,330 cigarette butts that she smoked in that year. All the ashtrays, the matches and the lighters. And ask yourself a simple question. Is this the life for me? Imagine in the room there's two pictures with two false beliefs on them. Imagine you're looking at one picture that says, well, my life is better smoking than it is without. And the other false belief saying, well, I feel more relaxed after one. And ask yourself a simple question. Is this the life for me? Imagine on the wall there's photographs throughout the year, different events and occasions, and everyone has a cigarette in their mouth. Another 4 minutes. All adding up to the 1 million minutes she's already smoked. Already adding up to the 248,000 cigarettes, there's now 255,000 cigarettes. And I want you to hate this, Ger. You know why? Because this is your future unless you make a decision. Imagine 5 years passing. There she is still smoking. And just look at her health, Ger. Look at her complexion. She's pale, she's weak. Imagine a calendar on the wall. Certain dates crossed off for hospital appointments, consultants, results, date. And imagine asking her why she keeps doing it. She says, well, listen, my life is better. And I feel better after it. It's okay. And it's okay. Imagine another few years, 10 years passes by, this time she's lying on her own deathbed. It's okay. And a big blackboard behind her with 1,000 excuses on why she never stopped. So my life is better. It's okay. Trust me, it won't last long. This is going to change your life, trust me. No, you okay with this? Sure. Okay, good. Imagine all the people who she loves, all the people who love her. And ask yourself a simple question, is this the life for you? And I really want you to feel this. First of all, okay. Because our marriage is this is your future unless you make that decision today. Okay. Okay. And imagine coming back out of that room, you coming back out of that room and sitting in the waiting room. And you know what I want you to do, Jim? I want you to focus on a sense of relief. Why? Simple. It hasn't happened. Sure, it doesn't have to happen. But through the door on the right there, meet you this time next year as a non-smoker. And look at the difference. Look at the health in her eye. Look at the sharpness, the health, the complexion. Look at her breathing. Look at how clean this room is. The windows are open, there's air. And then go back into the waiting room and make a decision. Take your time. Sit in that chair in the waiting room and make your decision. What's it to be? A life of hard and upon, if, ands and buts. Or a life where you see the truth. You've been conned. Two false beliefs, right? I mean, would you let anybody else con you like that? No. Make a decision. And when you make it, I want you to feel it in your heart. I want you to feel it in your stomach. I want you to feel it in every muscle, fiber, tissue. I want you to scream inside yourself that new decision. False upon it. Scream it. Feel it. Own it. And I want you to hate the fact that you've been fooled by two false beliefs. And you've made these tobacco companies thousands upon thousands of pounds based on two false beliefs. I'm just going to say the words. It's deeper and deeper and deeper and faster. Such your whole body relax, your mind sink deeper and deeper and deeper and deeper down the astral. And then just let it sink there. You see, you decided to come here today because little did you know you had actually already made a decision. And Ger, it's a final decision. And you've simply decided to take back control of the part of your life that was out of control. And you've decided to give smoke. But think about it another way. What have you actually given up, Ger? Well, you've given up the cough, pain, trouble, the slavery, the dark clouds, the guilt and the fear, the feeling weak, the pain through the nose, the social stigma, the panic, the cravings. So what you're really doing is you're giving up all the things that you don't want in your life in order to get the things that you do want in your life. Does that make sense? I want you to imagine how ridiculous this is. Hold a cigarette in one hand and an inhaler in the other. Funny, isn't it? Imagine putting the cigarette in your mouth, blowing out the smoke, and then putting the inhaler in your mouth and sucking in fresh air. Imagine looking at yourself doing that. Huh? Because that's the only thing you're going to feel. If anybody ever asks you to want a cigarette, you ever see them, you're just going to laugh at them. You know why you're going to laugh at them? Because you know the truth, you know the secret, and you know you're back in control. Imagine looking at you smoking, and how ridiculously funny that is. Imagine looking at that old Ger smoking a cigarette, putting 4,000 chemicals into her lungs and then putting an inhaler in to get oxygen. I mean, it is bloody fun, isn't it? Think about it. Come on. It's so funny that you couldn't even compute in your mind right now putting another one in your mouth. Because it's a joke. Imagine, like, and then. I I tell you, here's a funny one for you, right? I did a session like this, in a room like this, not too long ago, from a guy from Mayo. And in the intake there, he's telling me something really, really interesting, that he hated smoking. But when he smoked, and this is true, he used to go outside to the back garden, but when he lit up the cigarette, he used to put on a rubber glove. This is true. The reason he put the rubber glove on, he didn't want to smell the smoke off his fingers. And I say to him in the session, I said, oh, so you do that for your fingers, but you wouldn't do it for your lungs. And he started laughing. And so I just gently push down on your shoulder. That's good. So I want you to imagine 248,000 cigarette butts in front of you. Very first butt to the very last. Imagine the stage. Imagine looking at the gunk coming out of filters, the poison. And imagine pressing all the filters and getting the gunk into a 1 litre jug. And in the jug, just tobacco, there's ash, just filters. And now imagine pouring in the first third of that muck into your mouth. Imagine there right now going around your teeth, making your teeth go yellow. Up the walls of your mouth, right to the roof of your mouth. And feel the toxins and the poisons and the smoke and the stale. That's all right. Now press your shoulder. This will not be physically uncomfortable in any way. Imagine all that in your mouth right now. And on the count of 3 with my big fingers, you're going to have an immense desire to swallow. 1, 2, 3. Nice. Did it relax you? Did you like that? Okay. Let's try it again. Let's the second tour. Let's put the second tour. This is older, it's muckier, stench. This has ashes in it. So imagine ash all over your lips, the back of between your teeth. The filters under your tongue. And on the count of 3, you'd have an immense desire to swallow. 1, 2, 3. That one, Max.
No.
Like fur in your tongue there. Right touching your shoulder about business. Now, really, okay. This time we're going to just hold the jug up and scrape the dregs out. And flop into your mouth. Imagine looking at yourself in the mirror with this in your mouth. Thinking your life is better. Okay, touching your shoulder, physically you'll be okay. Imagine looking at yourself in the mirror. With all this around your lips, this brown ring. This brown ring of poison around your lips, thinking your life is better. Imagine that. That's funny. Because every time you see someone smoking, you just have to see a brown ring around their lips. Sorry, Barry. Every time you see someone, you're going to see this brown ring around their lips. And only you will see it. But imagine looking in the mirror with your mouth full of gum, thinking you're more secure and your life is better. With an inhaler in your hand. And thinking how secure that makes you. Now, when I click my fingers on the count of 3, you're going to swallow the last bucket load of gunk. For the last time, think about this. Now, it will be uncomfortable, but you'll be okay physically. 1, 2, 3. Imagine feeling the heat. Imagine feeling the toxins, the petrol.
Oh God.
Imagine feeling the nicotine in your mouth. And I want you to make a wish to yourself that you'll never have to experience this ever again. I just want you to lift this hand up in the air, high in the air, make a fist for me. I've got to show you one of your convincers what you do to make it into a tool. Yeah? And what I want you to imagine right now is that, imagine right now you have a cigarette in this hand, okay? And what I want you to do is try as hard as you can to put that into your mouth. But you're going to notice something interesting. That because your subconscious mind now sees the truth and understands the truth, it would be impossible. Because I guarantee you, right, by the time that hand gets to your mouth, about 6 inches away from your mouth, this elbow will lock up completely. You will not be able to get that cigarette in your mouth ever again. Now bend the arm really, really slowly, with the intention of putting a cigarette in your mouth. And as soon as it gets 6 inches away, it's going to lock. And it will become impossible to get that cigarette in your mouth. And I would really want you to try and put that hand in that mouth and notice it's impossible. Well, and push it, Jerry. Push it, try and get it in your mouth. Just like it's impossible for you to smoke. It's impossible for you to put that hand in your mouth, that cigarette in your mouth, with the brown ring around your mouth. But try hard, come on. Come on. Come on. You can even try pushing with this hand. Your subconscious will not let you smoke, I'm sorry. Come on, pull it as hard as you like. I'd even try that. Come on. See? Richard out. That's why we do what we do, yeah. Now, think about the fact that you're trying to put poison in your mouth that's going to leave a brown ring around your lips. You're going to need your inhaler because you're going to feel better. If you want to try pushing towards your mouth, trust it. Just because I want to see the power of this would not go. That's some power. I'm not joking. You want to feel it. Actually, if you do want to feel it, actually, feel it. Try and push that towards the mouth. But that's subconscious power. That's not physical power. That's subconscious. You go there. So you can hear. You can see if you can hear. Try and push it towards the mouth. It's deeper, 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 deeper. How powerful is that, Richard? Now, you can do the same for biting nails, couldn't you? The arm locks, you can't get the nails into your mouth. Drink. See? That's why we teach you Richard arm. This is brilliant for cleaning my nose. It's the only thing I think of. But, do you have a cigarette, Deborah? Please. Thank you. Now, put your eyes closed. I'm going to put this in first. Just put that down first. Yeah, there's your friend. That's your friend. You know the friend that will give you cancer? You know the friend that will take away your last breath? Take away years off your life? Not that friend. There it is. Does that make you feel too good? Let's see. Put that in hand. What a great feeling that is, isn't it? Isn't that a beautiful feeling? May we light it for you? Come on. Try and put it in your mouth. Come on. Try and lift it and put it in your mouth. Imagine in a month's time and try and put it in your mouth. Imagine 6 months' time and try and put it in your mouth. Imagine having a stressful time and the row with Jim. Jim giving out, you're feeling insecure, you really need something to help you, try and put it in your mouth. Imagine getting bad news, try and put it in your mouth.
No.
You don't? Because on the count of 3, your eyes are going open, you're going to see something between your fingers, and when you see it, the biggest penny will drop from here right down. And I guarantee you, it will be the possible to ever see the rest of your life. So when your eyes open, by the way, you're going to go into a deeper state of trance. 1, 2, 3, look at it. See? What does that mean to you? When you look at it, what are you thinking?
Why is it made?
Huh?
Why is it made?
Yeah, that's a good question. But is that what are you looking at?
Seems a little key.
Any drive with cigarettes in your pocket, how does that feel? Because earlier on you said you couldn't be at home on a Friday night without any, you panic. But now I'm saying to you, how do you feel about going home without any cigarettes in your pocket? Feel good? Okay. We'll finish it now in a second. So, before we do that, I'm just going to lift this hand here, and clock down there, and just want you to tap this finger up and down real fast, just like mine. That's it. And I'm just going to shorten everything I do. So when I click my fingers, you will not be able to stop the finger. You can try hard as you can, just try and stop it there, if possible. Once you imagine we're turning on the tap, and the tap of endorphins are starting to flow from here right down to your mind, to every muscle, fiber, tissue. It's that feeling of relaxation you've been seeking. But let that feeling of relaxation and security wash down to your neck, your shoulders, down to your chest, every muscle, fiber, tissue, down to your elbows, your fingers, down to your toes. And as this pumps, this is going to start pumping too. They both start. And now you've been pumping endorphins from head to toe. That's what you've been looking for with the cigarettes, and there you have them already, see? And you feel that feeling of security and safety. Because anytime you want this feeling, instead of putting a cigarette in your mouth, all you have to do is give the password right now. Give yourself a password to get this feeling back whenever you want it. So that if you are having a stressful day, things aren't going right, instead of having to poison yourself, you can just sit down and give yourself a secret password, and this feeling instantly comes flooding back into you, stronger than any cigarette, better than any cigarette. And those two fingers will completely keep tapping until your subconscious mind has finalized this new decision. It could take a second, it could take 30 seconds, or a minute. But when your subconscious mind has finally concluded that there is no more false beliefs, there is no more cigarettes, there is no more inhalers and cigarettes, those fingers will stop by themselves and your job is done. It will be impossible for you to ever stop. Didn't take long at all. So in a moment, you're going to count from 1 to 3, and on the count to 3, and not before your eyes will gently open. You will be back to normal levels of awareness. You will be feeling absolutely fantastic. But every time you see someone smoke, you'll just see that brown ring around their lips, and it will be funny. 1. Slowly, easily, sorry. 2. Feel yourself come back to normal levels of awareness. 3, eyes open and mouth back. So, get like, oh sorry, that's how you don't feel right?
No, tissue.
That's going to have to see that. Only oh, sorry, yeah. No, it's just, sorry, the reason I was doing that was I want to get feedback on it, for maybe, because you can ask questions, rather than me, like. Should I to ask some questions here? Oh, sorry. Would you go out and celebrate with a cigarette and not have a chat with these? Go on. What should I need to give you to go out and smoke?
Course fees back.
Huh? Yeah. That doesn't work. We did it, but it doesn't work. Remember Liz? Seriously, is there anything I can give you right now to make you go out and smoke a cigarette? The car? Not
No.
the car?
No.
Seriously?
Honestly, seriously. I don't like that.
Did you ever smoke it? Okay. That is how you do successful with smoking session. Pain of God, and then give them freedom. Yeah. Same in every session. Weight loss, everything. If you're too nice to them, they'll walk all over you. They'll be ringing you 2 days later going, hey, that didn't work, I'm back smoking. Yeah. Did you find it any way offensive and uncomfortable?
No, just very emotional. In the
So,
sense of,
she didn't take it personally, because I told her to start, listen, I'm going to be mean to you, is that okay?
Yeah.
I did.
yeah.
Let's try that today.
Yeah. Only works for me.
So I have a question, Carl. So say someone's come on for food, right? Do you
For weight loss?
Weight loss,
Yeah.
right. So would you sort of ask them to choose a particular food, or would we just a whole conversation about?
I would put the pain of God in them. Room to
Same.
left, room to right. When you can see you have 2 options in life, gives you really, it narrows it down. Well, you've got to make a decision either way. Either you want to keep smoking, or you want to keep getting bigger, or you don't.
I've had that turn, it hasn't worked with me.
Huh?
I've had that good stone with me, and it hasn't worked.
Yeah, it depends on the quality of the hypnosis. It depends on everything, bro.
Yeah.
You know, trust me.
I'm starting to realise it.
Yeah. Okay. And I'm glad you are, because it's shocking if you think something won't work for you when it hasn't been given right. I had fun with that session because that's not in your script, by the way, but it's everything we do. Sorry, the pain and pleasure, all that's there, yeah, it is. But
would you take away like biscuits and sweets, all the kind of negative food, you know,
Sugar.
that people would like, you know? that's
sugar, suggest sugar is much
just
easier.
sugar and then
Mars bars,
Yeah.
whirly whips, sugar.
sugar, yeah.
Carl, I've actually imagined, when it was done on me, I imagined opening a Mars bar and maggots coming out of it.
Yeah,
And
that's
it's still there.
Yeah, maggots can be nice.
Yeah, they're high protein.
Yeah, no, it's a big difference. Like, you know, trust me, how real was that running on that for you? What did what did it feel like? There, you're there looking at yourselves, smoking in the future. What's that feel like?
It's awful. I felt I couldn't catch my breath. And I just felt as if I was getting smoked with the butts of cigarettes and the stench of the smoke. And when you put me in my family, that was hard. That was
It would be hard. But you've already said you have chest infections. You're already telling me you're going there. I'm trying to stop you from that. Fair enough. And the great thing about it is we get feedback every month, don't we? Yeah.
In the mirror, Ger, when you were looking at yourself in the mirror.
Oh.
Actually,
In the mirror, looking left.
oh yeah. Like imagine embarrassing again about it and tell me what you see. Close your eyes. Or actually look at it like. What do you see? Big brown ring, she says. And that, see, something like that. See it? Actually, Bear, I'm not trying to embarrass you. Would you pull me in the just to see?
Oh,
What's this?
you really put me in spot now.
I am, I'm sorry, I am, but I just want to see for this report.
Beautiful, Ger.
Okay. What do you see? See it?
Red and brown and stuff.
They're from this side.
Will she laugh at every
How long will she
smoker?
keep that laugh?
Yeah.
How long will that laugh last?
Forever.
Oh, yeah, sorry.
Oh, sorry, you know, that's me or
Yeah.
sorry.
No, every time you see somebody smoking, you're going to laugh.
I'm not laughing. No, we won't be laughing.
No, we do.
Well, maybe we'll be laughing actually. Yeah.
I could get them.
Let's see. Tell you what, let's see how you go through lunch. If it's a problem, we get rid of it after that. How's that? I think probably. Does
She
anyone else
probably
got a
won't have the
cigarette?
laughter because she won't be around people that will smoke.
Yeah, because you don't get. Yeah, you don't get
go away.
stabbed.
You know, when you're walking out in the building where the people are smoking in the front.
Yeah, but she wants to keep going.
Point
Finger.
not meaning like everything you see.
The man now has the therapy card. What should he do?
No, we leave. Tell you what we do. We leave it till after lunch. If it's a problem, we change it. If it's not, we leave it. Is that fair enough? How bad to be laughing?
I was just going to say that. Very good.
Actually, Sue, I'm not trying to embarrass you. Can you put me on that? See what
I
happens?
did.
Oh, you did. You did.
Yeah,
Happens again. Sorry. Biggest round of applause, please, for this lady. So,
Well done.